Sherry Dolk lives in the small city of Barrie, just north of Toronto. 4 years ago, she lost her daughter Tina to an overdose of fentanyl. She was only 19 years old. Today, Sherry helps other parents of addicts and tries to raise awareness about the dangers of a prescription drug now flooding the black market.
Tina was a really smart, athletic girl. She was very social, lots of friends around. She was a great girl. The things I do is because of Tina, right? I want to make sure that people don't have to go through what we did. To me, it's the most important thing is to just help so that no one else dies.
Tina died after taking fentanyl found in patches just like these. They're used as legal painkillers, but Barrie police say many are illegally diverted from pharmacies and sold to addicts who cut them up and smoke or eat them. That's dangerous because the person taking the drug doesn't know how much they're getting.
So this is a 100 microgram patch. 2 micrograms can actually kill you. So depending on where you're getting the concentration in the patch, I mean, if you get that fatal dose, you don't know where it's coming from.
And it's a problem that the medical system itself has created. Canadians use more fentanyl and other opioids per capita than any other country, creating an appetite for some of the most addictive drugs on the planet. And lately, a market for online traffickers in illegal opioids from China and Mexico.
Doctors have been prescribing indiscriminately large amounts for very long durations to too many people, and basically we flooded our society with those opioids.
You would break open the ampule and drop the 1 ml of the medication, and you would inject it into the arm or the thigh.
The drug naloxone can revive people from even potentially fatal opioid overdoses. Public health nurse Mia Brown distributes these injection kits to addicts, and soon they'll be available to anyone without a prescription.
This is not enabling them to do drugs, it's enabling them to live life. So it's just a way of helping people that are overdosing on drugs. It could be anyone's child that this happens to, or anyone's family member.
Some pharmacies also require people with legal fentanyl prescriptions to bring back used patches and exchange them for new ones, making sure they don't go to the black market. But as long as Canadian doctors prescribe opioids on the scale they do now, it'll take many more years and perhaps many more deaths for Canada to kick this dangerous habit. Daniel Lack, Jazeera, Barrie, Ontario.